So our correlations are noted here. You're going to see that there are significant correlations between the co-parents, relationship satisfaction, and an inverse relationship with parents' reports of depression, stress, and anxiety, which we consider to be worry. And you also can see that there are significant relationships between co-parenting and an inverse correlation between depression, stress, and worry. Finally, you can note that there are some significant correlations between spiritual disclosure and an inverse relationship with worry. So again, higher rates of depression, anxiety, and stress are related to lower experiences of spiritual disclosure, co-parenting, and relationship satisfaction. And then in regards to negative religious coping, so feeling abandoned or angry with God, you're going to see that there is a significant positive correlation between that variable and depression, stress, and anxiety for parents. So as people experienced higher rates of negative religious coping, they also endorsed greater depression, stress, and anxiety. You're also going to note here in relation to the relationships and parenting variables, as people were able to talk more about religion and spirituality, they were able to indicate higher rates of relationship satisfaction and greater co-parenting. And as they were able to view God as a positive partner in experiencing this challenge, so positive religious coping, they also indicated greater relationship satisfaction. However, when they were indicating that they felt abandoned or angry with God, they had an inverse relationship with co-parenting, meaning that as negative religious coping increased, co-parenting decreased. So we also then ran some hierarchical regression analyses to try to better understand these relationships between our predictor variables, which were co-parenting, relationship satisfaction, spiritual disclosure, and religious and spiritual coping, both positive and negative. And then our outcome variables were worry, anxiety, and depression. Our regression results are, in a nutshell, co-parenting and negative religious coping are significant predictors toward parents' anxiety, depression, and NICU-related stress. I'm going to break those down further here. As you can see, what we did is in step 1, we put in co-parenting relationship satisfaction. And then in step 2, we entered the religion spirituality variables predicting to depression. And as you can see within this first set of analyses, there was a significant relationship between the first step and the outcome variable of depression, related to approximately 22% of the variance. In step 2, there appears to be a 7% change in variance related to the religious and spiritual variables, and it appears that the significant beta weights are related to negative religious coping in relation to parents' depression. A similar finding kind of came forward with the first step related to co-parenting and an inverse relationship with anxiety. And on the second step, we see again negative religious coping as being the significant beta weight, and approximately 6% of the change in variance is occurring with this model, the second model. And lastly, for NICU-related stress, again, co-parenting appears to be the significant beta weight in relation to NICU-related stress. So again, poor co-parenting is related to greater stress. And there appears to be an 11% additional variance provided by the second step, again, related to negative religious coping. So what does this mean? Essentially, this means the way we interpret these findings are that parents who talk about religious or spiritual issues tend to indicate better relationship satisfaction in co-parenting. So that's some of the, there's correlational links between those variables. Again, we cannot determine directionality, cause and effect, but we do know they're related. We also find that parents tend to experience poorer psychological well-being if they have poor relationship quality, which makes sense and has been somewhat proven in the literature already related to many other stressful situations. But again, this NICU setting is a very unique setting that we don't have as much data to explore a lot of the variables we looked at in the study. We also found that NICU parents who use more negative forms of religious coping tended to have poor relationship quality, again, This is a larger sample. This is a statewide sample in Pennsylvania that kind of corroborates some of the findings we had in our earlier study related to just local, a smaller sample of NICU parents. So co-parenting matters. Co-parenting matters. How parents agree on parenting and support each other with parenting decisions and share the labor matters for psychological well-being post-NICU stay. And so again, we can't determine what this looked like prior to the NICU experience, but we know now, based upon these results, it seems to be that your co-parenting matters for your psychological well-being. And psychological well-being matters for co-parenting. We also see that perceiving God as abandoning or angry when dealing with the NICU is related to poor outcomes post-NICU discharge, even after accounting for relational factors. So that in that psychological lens and that coping process of feeling angry or abandoning God, even if you have a very a supportive relationship with your co-parent, seems to have negative relationships with your psychological outcomes. So why do these results matter? My experience and that of many others indicate, that NICU parents have more fragile family units. The stress of parenting a sick child or feeling differences in opinion regarding the NICU experience can have impacts on the psychological well-being as well as relationship outcomes. So again, although we didn't look at cause and effect relationships, we know that these parents are endorsing higher levels of stress than parents who don't experience the NICU. We also know psychologically in the psychological literature and relationship literature that when parents have relationship challenges, that can have trickle-down effects on children. So there's definitely bidirectional relationships that happen, but the family unit is set up such that the parents are to be the support system for their children. And when they're not able to have a strong, cohesive family unit, there can be impacts on children. So we need to fortify these relationships, and we need to do our best to try to help families while they're in the NICU before they're discharged, to have as many resources as possible. Currently, there are few psychological supports in many NICUs. I'm fortunate enough to be in contact with some other psychologists who practice in the NICU. We do not have a psychologist dedicated to the NICU at Penn State Milton S. Hershey Medical Center. And very few people are doing research in the NICU looking at psychological factors. And I would say even fewer are looking at psychospiritual supports. So there are chaplains that come in the NICU and can support families, but professionals that have a good gauge of how to work with families in a psychospiritual way are very few and far between. And there are big existential questions that can come up related to a NICU experience, as per some of my previous research with in my lab, looking at spiritual struggles related to meaning and poor psychological outcomes for families. So as indicated, this is a cross-sectional study. I can't make any causal conclusions. We were not able to determine if there were baseline mental health issues and or relationship issues prior to the study. The sample is rather homogeneous, meaning that we have a large sample of married participants. We have a large Caucasian population as well as a large Christian population. And we also had to combine mother and father reports due to having a fewer number of father reports to be able to separate out analyses. So family-based NICU interventions, there's a lot out there that are discussed in the literature related to NICUs. And some of those basically talk about having parents as, they have to be part of the NICU process. They cannot be separate. Historically, babies have kind of been seen as, the nurse's patient, whereas they're a family member that's hospitalized, and they, the experience of integrating families into the process of being caregivers and to be part of the care in the NICU is vitally important. What I suggest is missing are twofold: a greater focus on the psychological needs of family members, be it the parents or other caregivers coming into the NICU. I also think there are large gaps in the literature and more importantly, practice related to exploring the the positive aspects of the resiliency factors related to parents' religious and spiritual beliefs in ways that can bolster and help them deal with psychological challenges. I also think on the flip side of that, there could be parents that are struggling with big existential questions like, why did this happen? Is God punishing me? How does this look for me in my family unit with my baby not being with me at home, when maybe that's what I would expect to have happen? And so we're not looking at those things, and I think that that is a big oversight in our field. And so that's where my goal is to develop, and I have been doing that with my research team, a psychological intervention for families that are in need in the NICU. That's a very short intervention that effectively, we're trying to see if that could be a sense of support and help with increasing some of the reports of high stress levels and issues with parenting competence post-discharge. So one of the things we were looking at with this intervention, these are some of the things we're considering, talking about your birth stories and emotions. So what are you experiencing, and being able to understand those emotions. Developing an understanding of your coping strategies and what can be effective and not effective for you. And via just simply exploring religious and spiritual beliefs can be also important. So just talking about them. Also instilling of hope. So hope is a big factor that can have positive results for people, even in the most dire circumstances. Hope can be important. And then linking to mentor families is also something that we've talked about as being really important. So these are some factors that we're looking at related to the psychological interventions. So I can just reiterate this one more time. I can't say it enough. We need better psychological supports in our NICU. We need to ask parents about their religious and spiritual views in relation to coping strategies. They may not have thought of those as being factors for them to consider. We need safe spaces to discuss concerns in the NICU. So where can parents go for advocating for themselves? And we need to prioritize linkages with community psychological and spiritual care post-discharge, because there are certainly issues with what do we do with individuals that are really struggling, having significant difficulties, and what do we do with individuals that just needed additional supports. So our next steps are what's called a community engagement studio. We're lucky enough at Penn State to have a clinical translational science award through the NIH, and so we're able to conduct what's called a CE studio, where we essentially work with parents that have been in the NICU to get some feedback on some of our interventions. And then we're going to be seeking out pilot funding for a small study to understand if an intervention would be helpful, again, with moms and dads to help decrease stress post-intervention and increase parenting competence. Thank you so much for listening to me. I realize this is an ideal setting to convey this information, but here is my email contact information if you need to or want to contact me about the study or my work in the NICU. I also want to say that my colleague, Dr. Kim Doheny, she is integral in all of my work. I couldn't do this without her. She has been my colleague and co-author and co-PI on all of my grant work. And this particular grant study was funded by the Children's Miracle Network. So I want to thank them for the good work that they do and the funding that they've provided to myself and many other researchers to help better children's lives after experiencing a medical issue. So thank you very much for your time. Hope you have a great day.